Did you know that there are 5 common causes of butt pain that most people, even doctors, aren't aware of? In this video, I'm going to tell you what those 5 things are, how you can begin to fix them yourself, and how to find solutions to help you manage your butt pain once and for all. So last week, I saw a patient who hadn't been able to sleep through the night for the past 9 months. She went to her doctor, who sent her to the orthopedist, who told her after her second visit, everything looked okay on x-rays, and she should just call back whenever she needs surgery. How does that help? To make matters worse, she said that during all of her visits, nobody ever touched her, even once. If you're like my patient with butt pain and you're ready to start feeling better, watch till the end to find out where your pain is coming from and what you can do to get rid of it. If you find this content valuable, please be sure to subscribe to our channel so you can learn more about all the different kinds of pain we can help. Okay, so obviously the first step in figuring out where your butt pain is coming from is getting the story from you, the patient. Sometimes there are clues that can really help to figure out where the pain is coming from. For instance, when someone tells me that every time they roll over in bed at night onto one side, they wake up in pain, I usually got a pretty good idea what's going on. And step 2 is probably even more important. We have to get the patient to show us exactly where they hurt. The butt is actually a pretty big place. The third step is getting the right kind of tests. X-rays of the spine, hip, and pelvis are great, but ultrasounds and MRIs can give us much more information about the soft tissues in the leg muscles, cartilage, and ligaments. We just can't see these things on X-rays, no matter what they say. Now we've taken these first 3 steps, it's time to move on to the 5 most common causes of butt pain. Cause number 1, muscle spasms of the gluteus maximus, gluteus medius, gluteus minimus, and piriformis muscles. These muscles play a huge role in posture, and when we have bad posture due to lots of sitting and slumping, this can lead to weakness and spasm of the muscle. What are the 3 things you can do to treat muscle spasms? Strengthening of the muscles and ligaments of the low back and pelvis region may help to stabilize the spine and pelvis and help these muscles to become less irritable over time. Working closely with a personal trainer or physical therapist can be the key to long-term success when these muscles are the culprit. Sometimes injecting a small amount of medicine into the muscles can help to temporarily relieve spasm and help our diagnosis, but this isn't a good long-term solution. It's not good for the muscles. Until you get at the source of the spasm, the pain will continue to come back again and again and again, which leads me to cause number 2. Lumbar disc degeneration or herniation. So the discs in your lumbar spine, otherwise known as the low back, are the spacers between the spinal bones. And especially with the lowest 2 discs, we can see bulging and even tears of the disc, which can irritate the nerves leading to the muscles in the buttocks and legs. So what are the 6 ways you can fix pain due to disc bulging? If your butt pain is due to bulging discs, then this is another great case for stretching and strengthening of the core muscles under the supervision of a great physical therapist, chiropractor, or personal trainer. But once we know that there are bulging discs involved, other things usually have to be done in addition to strengthening. This is where things like inversion therapy and spinal decompression come in handy. Taking pressure off of the discs with these techniques can be the key in relieving pressure on the nerves. Once the pressure on the nerves is relieved, the butt pain usually goes away. You can find inversion tables online for pretty cheap, and the key is to be very gradual in terms of how far and for how long you're hanging upside down. So if this is your head, you got to make sure you don't spend too much head down time. You also need to check with your doctor before doing inversion therapy to make sure it's safe for you. We also have some really cool braces which are lightweight and they inflate in a way that's kind of like a portable, wearable inversion table, taking pressure off the discs while you're walking around doing your thing. In some cases, you may need to see a specialist for injection of a low dose of steroid precisely targeting the disc and nerves under X-ray. As long as you're not getting too many injections, say once or twice a year with steroids, this is an okay way of managing things. But if the pain just keeps coming back, then it's time to think about injection of platelet-rich plasma or bone marrow concentrate around or directly into the discs, since we know that these provide longer lasting relief than steroid treatments and they come from your own body, so the chance of having a bad reaction is pretty low. Also important if you have diabetes, high blood pressure, or other things where steroids are a bad idea. Surgery should only be considered as a last resort for this type of problem. Cause number 3, the dreaded sacroiliac joint, otherwise known as the SI joint. This joint is the largest of the spinal joints and found on both sides of your tailbone. It's not quite your back, it's not quite your buttock, in between, just below the belt line, and there's one on your left, One in your right. This joint can get really aggravated during pregnancy, so if you're a new mom, you really have to keep the SI joint high on your list of suspects. If a patient tells me they've been having pain ever since they stepped down awkwardly off a step, or a running board, or on a truck, or into a hole out in the yard, or at the beach, I'm pretty sure they got an SI problem. The key for this diagnosis goes back to what I said at the beginning of the video. Most patients with SI problems will point exactly to the SI joint. Like 99% of the time, they point right to the middle of that SI joint. Remember that patient I was telling you about who couldn't roll over in bed at night? Classic SI symptom. So the SI joint can be a little bit more difficult to self-treat, but here's some tips. Core strengthening and pelvic stabilization exercises can be super helpful, especially the piriformis muscle, which attaches right underneath the SI joint. Belts that are specifically designed to stabilize and compress the SI joint are incredibly helpful for day-to-day activities such as walking and working in the yard. Injections of numbing medications with steroid are really helpful in making the diagnosis, and sometimes they may provide pretty good long-lasting results, but the more chronic the problem is, the more likely the pain is to come back. This is where other solutions like platelet-rich plasma and sugar injections come into play. Sugar! Yeah, you heard me right. I said sugar. We can use sugar, otherwise known as dextrose, to treat your SI pain. One study showed 60% relief at 15 months after sugar therapy compared to only a 10% relief in patients getting steroids. PRP performs even better than sugar. SI fusion may be required in some patients, but this should be the last step. Cause number 4, the lumbar facet joints. So you remember from the last example I told you that the SI joint is the largest joint in the spine? Well, the smallest joints are called the facet or facet joint. These are the knuckle joints of the low back. And just like any other joint in the body, they can get arthritis and become painful. They're located just above the belt line, and we have them on the right and the left, just like the SI joints. Usually people who have facet joint pain have both back pain and butt pain, but sometimes the body is trying to trick us, and the butt is the only place that hurts. Here are the 6 things you can do about facet pain. Paying attention to your posture and stabilizing the lumbar spine muscles is always a good idea for facet pain. Anti-inflammatory drugs like Motrin or Aleve can be very helpful in the short term, but not great for the long term. Sometimes even natural substitutes like turmeric can reduce the inflammation associated with facet pain. The same lumbar spine braces we use to take pressure off the disc can also be used to take pressure off the facet joints. Whenever I'm pressure washing my driveway, I make sure I'm wearing my inflatable decompression belt. It really helps me to stay out of trouble and stay active for hours instead of minutes, and we have those in our office. If the pain isn't going away with conservative treatments, then it's pretty easy to diagnose and even to treat facet joint pain with a procedure called radiofrequency ablation, or RFA. We use a specialized machine to zero in on the nerves and zap the nerves to the joints, taking away pain for 6 to 12 months for some people. Some people don't want to burn the nerves in their back, and for these folks, we see great results with PRP and bone marrow concentrate. So just like with discs and SI joints, surgery should be your last resort with facet pain. And finally, cause number 5, the hip joint. Yeah, it's pretty easy to identify severe arthritis of the hip on x-rays, but other things like tendon tears, tears of the labrum, and inflammation of the hip bursa can't be seen on x-rays, and this is where ultrasound and MRI come in. We can do ultrasound examinations right in the office when we first meet a patient and make our diagnosis pretty quickly. If we don't see anything on ultrasound, then an MRI is very helpful in identifying other problem areas. These are the 5 things that you can do to treat hip pain. Yep, you guessed it, strengthening, stretching, and supervised mobilizations of the hip under the care of a great PT, personal trainer, or chiropractor. In tough cases where conservative things aren't helping, injection into the hip joint with numbing medication or a very low dose of steroid can help to make our diagnosis. But these things can't be repeated. They're not good for the cartilage in your hip joint. It's not healthy. Since the bursa is not in the joint itself, we can be a little bit more liberal when treating these problem areas. Steroid injections into the bursa are not felt to be as damaging to the hip joint. Patients who are too young for hip replacement surgery or don't want surgery may be a great candidate for cellular therapy like PRP or bone marrow concentrate. They can also use gel or sugar just like the other joints. Be sure to check out our other videos on platelet-rich plasma and bone marrow concentrate to find out how these natural solutions can help you to eliminate chronic butt pain. If you're tired of the pain in your butt and you're ready to do something about it, click on the link below in the description to book an appointment.